Healthy Children and Youth, Beth Johns. Thank you.
Well, good morning, everybody. I'm Beth Johns. I'm a project director at the UAB School of Public Health, and I have the pleasure of chairing Healthy Children and Youth Priority Group with my trusty co-chair, Katie Peters, at United Way of Central Alabama. And we've been really focused over the past couple of years on improving child wellness. And our focus has been on and this is wordy too, I'm following Amanda with a wordy thing, advancing adoption of health and wellness best practices, curriculum and policies impacting children in out-of-school time programs like after-school programs, summer camps, and community centers. We also have a wonderful group. We don't have a fancy slide like Amanda did with all our partners on there, but we have an incredible group that have been working diligently to accomplish our Healthy Eating and Physical Activity project, which was also funded through the Public Health Advice Fund, which from the Jefferson County Department of Health through the Community Foundation of Greater Birmingham. There are three components to our project. We really wanted to go for best practice. I'm a nerdy public health person, talking about best practice and standards and the things that we want to do. So we wanted to make sure that what we were doing was held to a very high degree of quality. So we have been wanting to fully implement the Healthy Eating and Physical Activity Standards, which are called HEPA, at 4 YMCA after-school care sites. We established a healthy vending partnership, as well as to establish a cost-effective snack distribution system. This does not take a small group to do, and we've had wonderful partnerships and leaders. My buddy behind me on the left side here is going to take it away and talk about the details, so she can be able to tell you about yet another success of collaborative work in Jefferson County. This is Terri, I always call her Terri Nevette, but it's Terri Harvill, and she's with the YMCA, and we're very grateful for the Y for stepping up and being willing to not only do what the small group of us said we wanted to do, which was a minimal amount, but really when she begins to tell the story, you're going to see about the impact you can have when you have a leader in place like Stan Long and Terri, who are willing to really go out on the limb for us and move this work forward.
Good morning. So I am Terri Harvill. I'm a district vice president with the YMCA. And as Beth said, this project was funded by the Public Health Advice Fund, and it was administered by the Community Foundation. So what that means in essence is that the YMCA only served as a pilot. This work was done with the intention in mind that whatever we did could be replicated, it could be duplicated at any out-of-school program in our service areas. So this is not about the why. The why just took on the work, and we said, how can we make this happen for other providers? So the first objective was to implement the Healthy Eating and Physical Activity Standards, better known in short form as HEPA. Our 4 pilot sites were the Northeast Branch, which is located over in the Roebuck area, our Western Branch, which is located over near the Midfield, Fairfield city line. Our third one was the Trussville YMCA, which obviously is in the city of Trussville. And our last pilot site was the Shades Valley YMCA, which is located in Homewood. Very intentionally, we wanted to have diverse communities and diverse populations. So our number one success is that we did implement the HEPA standards in those 4 pilot sites. However, our president and CEO, Stan Law, said, you will just be pilots, but this is for every site. So we're happy to announce that not only are the 4 pilot sites involved in implementing the HEPA standards, but all of our after-school care sites as well as summer day camp sites. So that goes from 4 sites to 12 sites. As a matter of fact, while we're in this meeting now, they are actually meeting, all of our child care directors are in a meeting right now at our Shades Valley branch talking about how to progress this work for the first quarter of next year. The second thing is we have a formal partnership with the Stanford University School of Nursing. Right now there are 48 nursing students who are going out to all of those after-school care sites helping to implement the nutrition education piece. That's called a community resource. They needed to be able to have somewhere where their students could get hands-on experience teaching children, and we have children who need to be taught in nutrition and physical education, which goes along with what? The HEPA standards. Our third and final piece of progress we'll share today is that for our 4 pilot sites, we did do community healthy living index assessments. A lot of you may remember those as being chili, not the chili that you eat, but the chili that you do for an assessment tool. And with that assessment, we get a feel for the baseline present atmosphere of health. What does health look like in those after-school care programs presently? Well, as of today, we have completed chili assessments for those 4 pilot sites, but throughout the first quarter of next year, we would have completed chilies for all of our after-school care sites, once again, in the Birmingham area. So what's good for those 4 will be implemented at all of our program sites. Our second objective was to create a healthy vending collaborative to successfully implement new vending guidelines and standardized offerings at those 4 pilot sites. Well, wouldn't you know, we have vending at every YMCA. And so once again, we wanted to think about not only the YMCA's ability to do whatever we were thinking, but what could a mom and pop daycare center implement? Well, the Alabama Department of Public Health already has a vending program with standards in mind. It's called Good Choice. Some of you may have that in your workplaces. When they invented the program, originally it was for workplace vending. But we had a meeting, sat down with 4 of their partners at the Alabama Department of Public Health, and they have come with resources, unlimited. There's already research done, and so in essence, it's able to be duplicated anywhere, no cost to the provider. And so the number one question is, can it happen over and over and over again? The answer is yes. And so what happens is they come with their standards, and so if you imagine going to a vending machine and you imagine seeing the marketing and it's telling you for what you need to have to qualify as a good choice. It helps you understand reading the labels, and then it comes along with those marketing tools. Marketing tools that can be posters, that can be t-shirts, and they come with resources of nurses that will come and help educate not only our after-school participants, but also our YMCA members. And so that was a no-brainer for us not to have to recreate that wheel. All of our YMCAs will implement the Good Choice system by the end of this year. So if you're a YMCA member or not and come into one of our facilities beginning first quarter next year, you'll start seeing this Good Choice happy face all around, and you will be privy to know what that's all about. You read it, it can be duplicated anywhere you go. So the beauty of the Good Choice system is that the education for Good Choice can be taken with children and parents, so when they're in Walmart, when they're in grocery stores, they can use those same standards to make healthier choices at home, and that's our end result. All of our branches will maintain initially a 50-50 ratio of healthy to unhealthy items. However, our goal is that we get that 50 to 70%, and by the end of next year, going into 2016, to 90%. We found out when we did our baseline studies that some of our YMCAs were actually at a 70 to 30 ratio of unhealthy to healthy, but then some of them were at 90 to 10. Why is that? Because we found out that the drivers of our vending are the ones that were determining what was going in our machines. It didn't matter what we asked for, it mattered what the driver felt like they needed their commission to be. But don't you know, we've had several meetings to address that since then. And so we will be able to address what actually goes into our vending based on the Healthy Choice system. Last but not least, our third objective was to establish a cost-effective healthy snack distribution system and to launch a healthy food marketing campaign. So in this room, as you all know, we have several partners. The first one that came up was Amanda Story, and she shared with us that their objective is to increase access to affordable, healthy food. If you ask any child care provider what their number one barrier is to providing more fruits and vegetables, it's going to be the cost. If it's not that it's available in their communities, the second thing is going to be the cost, because even if it is available, they can't afford it. With the help of the Community Food Bank, I'm happy to announce that all of our YMCA branches, not just the 4, who are involved in after-school and summer day camp programs, now have an official partnership with the with the Community Food Bank, we have established or helped to establish systems internally that can be duplicated at other child care providers. All of our branches in summer camp this past year began to purchase their snacks from the food bank, and wouldn't you know, we experienced a dramatic cost saving, so much so that the 4 pilot sites experienced a 68% average monthly cost savings. Not only was there a cost savings, but there were more fruits and vegetables served than ever before. I've been with the YMCA for 23 years. I've never seen more apples, more bananas, more fruits and vegetables than 2014. There's a food and fun curriculum that the YMCA has adopted to use to help us market to the children and to parents the importance of eating healthy. And so we will tell you that you can't market to children to eat healthy and expect it to continue after they leave if you don't market and help educate the parents. So what we found to do that is that food and fun curriculum. Now, our next steps include, but are not limited to. I told Stan, I said, Stan, we can't tell the whole story. This is all the time we have. So we chose to share some of the most important things, but if you see us outside of this venue, please know that we have more work than time. So the number one next step that we will be doing is with our healthy eating and physical activity, we will be offering technical assistance to after-school providers interested in adopting the HEPA standards. We will share with them our ups and our downs. We will share with them what we did. This worked for us. This may work for you. Try this. You may not want to try that. However, we're not just going to provide technical assistance. The YMCA was able, through the REACH grant, to actually secure funding for 10 to 12 non-YMCA sites to get catch curriculum kits. Those kits run about $1,600. It's a pretty big deal. So we're not only going to help them get the kits, but we will help teach them how to implement the catch curriculum, which is an evidence-based physical activity curriculum for children. It also includes nutrition education as well. Number two, we will implement and evaluate our vending policy. So we're going to ensure continuity in vending standards throughout our association. And so that means that we have intentionally placed someone in our association over making sure that we are doing what we say we're doing. And we're going to continue to monitor how we move that 50 to 70 to 90% of good, healthy choices in our vending. Number three, we're going to build upon the current snack distribution system. What does that mean? So right now, that looks like every branch is ordering on their own. And it's been working well, but we want to refine that system so that we can help the food bank get healthier options by using leverage of volume. And so internally, our CEO has a wonderful idea that we are going to create possibly our own web-based tool so that we can streamline and consolidate our ordering, and whatever tools we create, we're going to be happy to share with other providers so that when the food bank says, we can order X amount of bananas if X amount of people come get them, we're going to make that happen. So that means we're going to be consistent in what we're allowing them to have at the food bank for us by ordering together, collectively, because we know that we can work smarter and not harder when we work better together. And we thank you for allowing us to be the tool and the vessel to do this pilot, and we are confident that we will replicate and duplicate this great work all over our service area. Thank you so very much.